Yes.
So first question is that chi flow. I roughly understand like this EAV is tissue meridians, but we often talk about sedate and tone. So I like lymph meridian means we often say like sedate
Hey, you
something.
are an old
So
student,
that
a very serious senior fellow. So tone is of three types, three varieties. And sedate is of also three varieties. Here, when we are talking of tissue meridians, Shiva, we are only using the round magnets, either or seeds. We are not imposing any direction. We are not trying to transfer it from one place to other place. What we are trying to do? We are trying to increase the domain or influence of the chi accumulated at that particular point. The effect of chi, right?
okay, sir. Because
Only one variety, one type we
okay,
recommend.
sir. Okay, sir. Because okay, sir. Because I thought like EAV meridians are equivalent to superficial circulation meridians,
They are
and
not superficial.
all like
They are
E
not
follows.
superficial. The chi, Dr. Wall said that it is accumulated right next to the bone, deep inside. You see, there are five kinds of depths of a needle that you can have, five depths. You are done with me, tongue acupuncture.
No, sir. Tunga, which I did not do with you.
You have not done. You should do once. So depth is according to the tissue. The most superficial is the skin. When you want to treat the tissue, skin tissue, depth is very superficial. Next is blood vessels. Next is adipose fat. Next is further deep muscles, and the deepest is bone.
Then bone.
In EAV, it is the deepest that you go for. Just hair touch the bone wherever you go for EAV. Got it?
Okay, sir. Okay, sir. Second question is related to kidney meridian. So, like I roughly understand, spleen, there is a major invention from EAV, like right side is pancreas and left side is spleen. But from kidney point of view, we are most interested like water kidney and fire kidney with respect to gender also like that. So, from your thought process, anything just to query, sir, nothing
Nothing.
special in it.
Nothing. Dr. Wall has no idea of fire and water. He had no idea of fire kidney and water kidney. For them, both kidneys are same. Even today, in allopathic system, hmm, the two kidneys are same. Only thing is, their height is a little on the right side, it is a little lower, and on the left side, it is a little higher. Both the sizes are also more or less same, not much change. Everything is same. It is the TCN that talks, and that talks of real kidney and the Nakli kidney. Nakli means the kidney which was first formed, that is the real kidney. So they say that the real kidney is only one. Which one? The water kidney.
Water kidney.
Hmm. And later the fire kidney was developed. Hmm. So the essence, etc., is nearer to the heart of the water kidney. Good question, Shiva, no doubt. But EAV, all this is not there because Dr. Wall had no He never tried to really go for treatment. Good. Yes. Next.
Sir,
So this concept is
so
not there. Both
respective
sides.
meridian map to the
Kidney.
respective either
I can't hear you.
kidney. Okay, sir. Okay, sir.
Anything else?
Third question is related to that. Third question is like that O-ring test because
Over.
in ARA we studied about it.
Ovary?
Then I looked into it.
No, no. Kya?
So
What you?
just
Pardon.
O-ring test.
O-ring test I've never
Okay.
heard, but this is for the first time that you are talking about. What is that test?
Okay, sir. Okay, sir. Like
Really? Go ahead. Go ahead. Try,
if
try
you
to
see
explain.
that, okay, sir. So O-ring test is like diagnosing the impacted areas of tissues or cells in the human body by just identify, like say, that is also following the same magnetic resonance
Huh?
approach and trying to identify. Say, so for example, if suppose
No,
the
I think
stomach.
I got it. I got it. Don't worry. People are there who are trying and treating also, and they're getting results. There's one fellow in Hyderabad only. He used to come to my classes, and I went to his clinic also. A very knowledgeable person otherwise. You see, what are we? We are units of
Chi.
vibration. Vibration getting a form, isn't it? Whole body, every cell is vibration. And if every cell is vibration, then every tissue is a vibration. Is it? Individual and collective. So every organ has a vibration, unique vibration. The way you function, your sound and my sound, that is also vibration. They differ, isn't it? The voices now can be traced by AI, artificial intelligence. They can copy it. What is all that? Vibration. Skin is a vibration. Fat is a vibration. Therefore, every organ is a vibration. So what they did, they have developed a machine, right? They have calibrated vibration of each organ. Hmm? No such thing I am teaching, nothing. I am telling you what I have seen, what I have experienced. I sat in his clinic for 3 days and I saw what he was doing. So he used to take water and he used to take in like a homeopathic medicine when you get in bottles, small bottles, pills, and also liquid also, such bottles, filling it with water and keeping it. So there was a platform made in that machine. And then there was a knob, which one or two or three knobs where you can set the vibrations. And for a certain period of time, they will keep it. So the vibrations will get into the water. And that water, after acupuncture, he used to give as medicine, depending on whatever he is diagnosed.
Electrohomeopathy,
So
something.
similarly,
Okay.
and he was getting results. Similarly, maybe this diagnosis process which you are talking about, they might have seen that vibration of a particular organ, and if you put the vibration and then change, like resistance, Dr. Wall, what he did, he calibrated the resistance across a particular point. What is, and the point is what? A collection of vibration is there. That's what is chi? Collection of vibrations, isn't it? Pockets of vibration. Hmm? Right? So everything is vibration. So maybe he probably developed and then he matched. So whether you want to keep the same frequency or you want to mismatch, you say mismatching will also give you some result. And matching will also give you some result, right? Now, matching will what do what? It will bring stagnation. This is what is my thinking, me being a student of physics as you are. So excess of
Okay,
chi
that is
means
very interesting,
stagnation.
sir. That right,
And
right.
you remember the primary coil and the secondary coil of transformer.
Yeah, yes, sir.
How does it happen? The current passes only in primary coil, and the current appears in secondary coil. Is some maybe something like that. I don't know. I haven't done anything about it. I have not read also. I'm just hearing from you, and I'm trying to interpolate and trying to give you some kind of satisfaction. I'm not the master. You will have to go to a person who really knows about it and is practicing. All right, Shiva. I'm sorry, but whatever I could
Thank you.
understand,
Thank you.
whatever you have said,
Thank you, sir. Thank you, sir. That's all.
that's all. Okay, good. ठीक है, Venkatesh, you wanted to say something.
सर सर ये सुपरफिशियल नोड ये डिफरेंस ही हियर इंडिकेट्स K2 में टच करे तो भी उसका किडनी स्टोन का पता चल जाता है K2
अच्छा, कहाँ ये कहीं पे मिला है, लिखा है?
सर ये डेफिशिएंसी हियर इंडिकेट्स ए स्टोन K2
Okay, to deficiency indicates may. There may be.
maybe
होगा, I don't know.
yes
I just don't know. K2 is fire point or water point?
fire points
And if I say it is a water point, then?
in VGs
Fire point may be for the kidney, but for heart it is water point.
water
आराम से. Maybe, may not be.
yes
And Shao Yin is the long meridian. K2,
sure
we have not taken K2 there. What we have taken? We have taken K3. K1, K3. Anyway, maybe what you're saying may be correct. I don't know.
okay.
Right. Good. Yes, Iqbal.
Sir, not related to this topic, but in near my center, there is a barber who just hold this finger for 10 to 15 minutes or 20 minutes, just this finger for any disease, the left hand finger, this one, and he's getting good result. There are almost, I think there is almost queue there. In
Go and ask him. Try to learn. We know that this is, according to Wall, deep lymphatic organ and triple warmer meridian means all endocrinal system. In our body, we have so many systems in which there are two prominent and very important systems. One is the nervous system, and another is the endocrinal system. For nerves, the energy, hotness, right? The energy is hotness. So on the inside, we go to pericardium. That is nerves, isn't it? Even in regional diagnosis, what do? We go to spinal cord through hotness energy, isn't it? All the nerves we treat through hotness energy. That is pericardium. And triple warmer is endocrinal system. And it is also affecting because it is related to pericardium. Pericardium is all kinds of yin chi, and triple warmer is all kinds of yang chi. isn't it? So endocrinal system is also yang, and nervous system is, of course, that is also yang. Now, nervous system is more like immediate movement, like wind. It will be difficult for you to understand unless you have done level 1 and level 2, right? Because this requires to really understand where the chi comes in pericardium and triple warmer. You see, every meridian is getting chi from one organ. Right? Lungs meridian will get the chi from lungs organ. Liver meridian will get the chi from liver organ. How about pericardium? Where does it get the energy from? Chi kahan se aata hai? Triple warmer. This you have to understand. And then you will have to understand that wind and heat both belong to yang. But there is a difference. Wind is a shock. Wind is a jerk. Whereas heat is continuity, kind of a continuous push. That is fire. Hmm? So, nervous system and endocrinal system are like that. Endocrinal system is more like slow, continuous. Whereas nervous system is with a jerk, immediate. करते करते होगा एक बार.
Yes, sir. Yes, sir.
सुनते सुनते होगा. All
नहीं,
these things which you are asking, all cannot be answered immediately. In fact, not that I'm not able to answer, or you have to really come up to it. Because I have told you what I wanted to tell you. But I don't think you can get it so easily unless you have
no.
listened to
The
me.
basic knowledge is compulsory.
Not basic knowledge, the philosophy.
Awesome.
Every pathy has a philosophy. Homeopathy has a philosophy. Unani has a philosophy. Even Hijama has a philosophy. Right? Allopathy has a philosophy. Philosophy executed is therapy. So they have to confirm. Hypothecate, hypothesis is there, then they try it. If it is confirmed, then they say, then they write the book, they claim everything. Right?
Thanks.
Acha hai, good. Anything else?
सर सर पूछे कुछ
अब पूछिए क्या है, पूछने में क्या जाता है,
सर
पूछने में क्या
LI
जाता है?
LI 12 LI 13
LI
और ST 12 LI 13 और ST 36 ST 37 पे सबसे ज्यादा गैस है सर, दबाने पे निकलती है.
LI 11
12
12
13
अच्छा
और 13 और ST 36 37 लेफ्ट साइड में LI 12 LI 13
तो ऐसा
और
करो
पैर में जी.
अभी ऐसा करो, SP4 P6 लगाओ.
अच्छा
एज पर रूल्स.
नहीं
इसमें LI भी आ जाएगा, ST भी आ जाएगा. उसके बाद those points what we are talking about is they are very young. ST36 is the most young chi in the body is available at ST36. LI12 is also, I take it to be young because LI11 is also a humidity. So LI12, LI11, in fact, many scholars have differ in the location of LI11. LI11 is not available just by reading book. It requires a lot of experience because LI11, for example, when I take LI11, see the book says that this crease, this is LI11, but I don't take like that. I take like this is LI11. So all the scholars, they take LI11, the location a little bit differs, right? Like Dr. Wall, so many points, locations are different. Right? Then K6, that also differs. UB62, the location is different for different persons. So every person may not have. So I take LIL12 to be one of the category is near LI11. So that is also young. ST36 is also young. ST37 is lower Hisi point of LI. And ST38 is connected to LI again, right? We use ST38 for frozen shoulder, according to traditional TCM, isn't it?
Yes.
So it is LIST. So long meridian Yangming. Now, long meridian Yangming
Yes.
is connected to two other meridians. Which other meridians? One is Tai Yin, another is Jiu Yin. So
Yes.
first target you should have LIST, that is Yangming,
Yes.
right?
Yes.
So what exactly is happening? When you press, the gas comes out, isn't it? That is what is you're talking.
Yes. Yes, sir. Yes, sir.
And it comes out, and it in the main course it touches your vocal cords.
Yes.
Now vocal cords with regional diagnosis is fire and connected to heart. Now SP4 is connected to heart also. Pericardium is connected to heart also, right? And SP4 is connected to ST30 and ST37.
Yes.
Lower shoe point is ST38 and upper is UB11
Yes.
of penetrating vessel. You have done EOB also.
Yes.
So what I would suggest, you can try SP4P6, SI3UB62, and you can also try long meridian Yangming. What should you do? This coming out is a kind of a yang, which is out.
Yes. Yes.
So I would suggest, I don't exactly know, but you can try. First, you try sedation of humidity and tonification of cold. And next, you can try tonification of humidity and sedation of cold on LIST, long meridian,
Yes.
long meridian, both sides,
Yes.
right? And whatever you get result. Have you tried ST36 or LI12 sedation and tonification? No.
Nice.
Is it painful when you
Ye-
press? Is it painful when you press?
Yes, sir. Pain.
Extra pain, hai?
Yes.
You have to sedate. That means yang has to be sedated. So what you do is sedate humidity
Yes.
and sedate heat in long meridian.
जी,
What are the points in LIST?
ठीक
LIST में humidity
नॉर्मल
होता है, ST45 is humidity. ST45 is
मिट्टी
humidity. हाँ, fire कौन सा है? ST41. Sedate both
यस
these and
जी
tone LI2.
यस
Tone LI2. No, sorry,
यस
not LI2, LI5. Sorry. LI5 is fire.
यस
ऐसे नॉर्मल में, लेकिन लॉन्ग मेरिडियन में दिस इज कोल्ड वाटर.
यस
So you have to 25
यस
LI5. समझ में आ रही है बात आपको? क्या कहा?
यस सर यस सर
SP4P6 SI3UB62, right?
ठीक
Right? And what else you can do? You can take lymph points of large intestine,
ये सब जो है
stomach.
एल आई 3 में जो है ये निकलती है इसमें भी बहुत ज्यादा
आप छोड़ दो ना, हम तो अभी लॉन्ग मेरिडियन ले रहे हैं ना.
अच्छा अच्छा
लॉन्ग मेरिडियन ले रहे हैं आप.
ठीक
हाँ,
हम्म,
तो लॉन्ग मेरिडियन में हम लोगों को क्या करना है? हीट ह्यूमिडिटी सेडेट कोल्ड टोन.
बस
बुक है ना आपके पास, बीजी मेरिडियन वाली?
है सर, है।
उसमें पॉइंट्स है
है।
सारे।
ठीक।
नहीं, अब देखो ईएवी में क्या कर सकते हैं।
जी।
हम लोगों को लिम्फ के पॉइंट को सेलेक्ट करना चाहिए। कौन सा? LI, ST एंड SI। LI, तो LI का कौन सा लिम्फ है? LY7।
यस।
SI का कौन सा है ये भी देखो, है ना?
जी।
तो सारे मेरिडियन में एक एक है, वन वन। नहीं,
यस।
LI11, SI11, ये सब लिम्फ के पॉइंट है। ST 45, 44, कौन सा
यस।
पॉइंट है स्टमक का? स्टमक का लिम्फ कौन सा है? यू रिमेम्बर? मैं बताऊं? शुड आई टेल यू?
यस। यस।
डॉक्टर वॉल का CMP है ST44B, वो लगाना मत भूलिए।
जी।
नहीं, हाँ। और ST44D, डी फॉर डेली, दैट इज लिम्फ वेसल ऑफ स्टमक।
यस।
और ST45 ले ही रहे हैं, तो एस टी फोर्टी
यस।
फाइव ST44D। अब ST44D बिलोंग्स टू द डोमेन ऑफ ST45, इज इट?
यस।
वही है ना,
यस।
पास पास में है।
यस।
ST44D एंड ST44B।
CMP।
और CMP ST44C। ठीक।
यस।
ST44B is CMP. A, B, and C. C is innervation, celiac plexus।
यस।
तो नाभि सेट करना चाहिए आपको। कभी ट्राई किया सेट करने का?
वो डिस्टर्ब हो जाती सर, गैस की वजह से।
तो ST44C इज अ मस्ट।
जी।
तो ST44C को क्या करोगे? बिकॉज दिस इज सीलियक प्लेक्सस, लेफ्ट साइड।
सीडेट किया था सर।
दोनों तरफ सेडेट करो।
अस।
राइट इज मोर इंपॉर्टेंट ऑफ कोर्स।
यस।
तो आप दोनों तरफ मेथी का दाना लगा कर रख दो।
ठीक।
दोनों तरफ ST44C, ST44B, ST44D सब
जी।
लगाओ। और लॉन्ग मेरिडियन
ठीक।
में हीट, ह्यूमिडिटी, सेडेट,
ठीक।
कोल्ड
हीटोन।
टोन। कौन सा? LIST वाला।
लाइफ 5।
LIST है
ठीक।
दोनों तरफ।
ठीक।
और EOB कौन सा? SP4P6।
ASI 3
SI,
UV62। SP4
SP4P6
P6।
एज पर रूल्स।
ठीक।
बस वो तो गया, निकल गया।
हम्म।
आपका फॉर्मूला बन गया। करिए,
हम्म।
करके बताइएगा।
ठीक।
चलो, शैल वी गो अहेड?
यस।
रेडी?
यस सर।
रेडी। अच्छा है। शिवा के आने से थोड़ा क्लास में जान आ गई। Shiva tries to apply his brain. That's good. This is urinary bladder. K1A is ureter. पेशाब की जो थैली है उसका पॉइंट कौन सा है? UB66A. And the trigon, this portion is UB66. And just the junction of this trigon with urethra, you have in males, you have prostate, which has again 6 lobes. Most of the time in the males, it is the anterior lobe. But sometimes there are different lobes. But if you take 65, total prostate will be taken care of. Right? So for prostate treatment, we start with UB65 according to EAV. Electroacupuncture according to Dr. Wall. Right? Anterior portion, UB52. And posterior portion, UB51A. And the sphincter, right? ये sphincter damage हो जाता है generally those ladies who go for multiple abortions, right? Or surgeries, multiple childbirth. So as they grow old, this sphincter becomes weak. In that case, you will be 30, right? So all this is there. Then, so these are the parts of urinary bladder organ. Now we will next go to the meridian and see the points, various points. So we will take one by one. Now UB67 is a big point. This can be used for many things. And one of them is for pregnant women having a breech position of the child in the womb. There what we do is we moxibustion at UB67. That causes a release of certain hormones which makes the movement inside the womb of the child so that it comes in the normal position, heads down at the vaginal opening, cervix. Right? So this point has a special use in that case. Otherwise, this is body of urinary bladder. Right? And for that, it can be used. UB66D. Can you see UB66D? बड़ा करूं इसको? Should I enlarge it further? दिख रहा है सबको? UB66D क्या क्या होगा ये? What this will be? ये lymph वाला पॉइंट है हर मेरिडियन में, है ना? All of you know by now that this point is Jingwell point, यहां सरक के चला गया, and this is lymph point in every meridian. And then this is innervation point. Every meridian, this location is innervation. So this is a plexus nerve. Autonomic innervation point. This is a sympathetic nerve. Sympathetic nerve कब use करते हैं? When you want that it should constrict so that the force movement increases. So old age में when residual urine remains, पूरा evacuate नहीं होता है, उस टाइम में इसको क्या करना चाहिए? 66C को what we should do? टोन करना चाहिए. हेलो, नहीं, अगर पूरा फुल्ली evacuate नहीं होगा urinary bladder, if it doesn't contract and if it is not fully evacuated, then it will be frequently giving you UTI. So if the evacuation, that is residual urine, is more, then you should tonify UB66C in case of older elderly people, especially males, where prostate has enlarged. This can help to some extent in whatever is the capacity of the muscle, it will increase the innervation, right? Then comes 66B, which is CMP. So this is a CMP for urogenital organ, not only urinary bladder, urogenital organs. This is CMP. Okay. So ये CMP location, this is true for every meridian. So any problem in urine as well as genitals, you can use this CMP. Then comes 66A. This is now peritoneum. Peritoneum, I have said, serous coating membrane होता है. That is the site for ulcers, etc. So this will not only, so peritoneum, the same membrane is covering uterus, ovaries, fallopian tubes, and the, what do you call, the rectum, etc. And in males, this is 66A. The capacity to hold semen. And if ejaculation is painful, etc., then also you can use it. UV66A. In females, it covers, of course, uterus, ovaries. And the vaginal canal, all that. So this peritoneum, any injury, any ulcer, any burning sensation, anything, then you can use UB66A. Then comes UB66. Of course, this is a point of trigon, neck of
तो सब पे sedation करेंगे ना?
हाँ, obviously. अल्सर हो गया तो सेडेट ही करेंगे ना. UB66, this is neck of bladder and vesicle sphincter. So incontinence में we can use this UB66. Then comes UB65. This is a very important point from the point of view of males especially. This is partial summation measurement point for anterior and posterior portion of urethra. In males, this is responsible for the seminal vesicle, that the bag which holds semen, and the hillock. In fact, the semen is ejaculated only after the hillock is crossed. So this can be used there. Which point? UB65. UB65. Right? So UB65 should be used for also your erectile dysfunction, prostate, premature ejaculation. You can use this and this both. So you can use all these points for all your urogenital problem, right? In females, UB65 can be used for uterus, vagina, or internal portion of the vagina, urethra. So UB65 becomes very important. So all the points from here to here, they are very important for urogenital organs. What you can do? Any complaint, put all the points, you can put seeds. At times, in females, you can find a very complicated problem. The outer lips of the vagina, which is known as Bartholin's gland. That also this UB65 treats. So if there is swelling or if there is a pain, etc., remember to sedate it. Even in prostate, we sedate it, right? And in TCM, what is this point? UB65 is wood point. You remember? All of you must be, right? This is wood point. And what is this? This dryness point. And what is this? Water point. Okay. Now this has been broken into A, B, C, and D. So you can use whatever you want. If you want nerves, you can use this. If you want lymph, you can use this. Right? CNP, of course, you can use it. And for all other problems, never forget to use 66A. So these 2 points. And of course, this point. So all the points you can apply. Maybe you can apply small methi dana. This is another very important point, especially in males. This is a point of epididymis. What is epididymis? See, the semen is made in the testicles and then it is carried forward For ejaculation, it goes up to the tip. So this is point for that. Vas deferens. They are fine tubes through which the semen passes from your testicle to up to the urethra. Right? So you can maybe sedate it to hold your semen longer. In females, this is affecting the fembryo, that which carries the ovum in the uterine tube, fallopian tubes. Right? So ovaries, from ovaries, this carries that. So for ovaries or gonads, for all this, if you want to use 65, 64, 66A, you can also use the point of gonads on triple Warmer meridian. What was the point of triple Warmer meridian? Triple Warmer 1. Then there are, all right, points are not very important. From allopathic point of view, this is 63. You can now see in your book, treatise 4. 63. This is lower hypogastric plexus. This is the innervation point. Then 62, it has importance from the point of view of EOV, extraordinary vessels. 61 is an important point because this is a point for the nerves of lumbar and legs. That means sciatic nerve. So 61 is a big point for sciatic nerve and sciatic pain. You can easily just, if one point has to be held, it is point number 61, which will help you with sciatic pain. So for sciatic pain, 61. Nerves of lumbar vertebra, sacrum vertebrae, and coccyx. Then, of course, there are all simple points. UB 54 new points, and old number is BL 40, just behind the knee. The popliteal plexus, which again should be used for sciatic pain, etc. Right? UB50C and UB51, if you care to see, these are points of UB51 is a point of penis or vagina. And 50C is cavernous sinus or plexus of penis. So if you have erectile dysfunction, UB50C becomes a very, very important point. This is again a sympathetic nerve. What should you do? UB50C. You should tonify. Hmm? UB50C is a big point. And this is also in females, UB50C will, of course, clitoris, if you know that. What is that? That is the essential point for having the peak of the sexual intercourse for females. That has a lot of nerve endings. So similarly, these points are, of course, uh, like that. So a lot of points are there which will affect uh, the whole of the region. Let me see if I have. Can't see this. Can't find it. Let me see if I have an image which I want to show you so that you will have an importance of uh, yes. UB65, how it affects this image I have, and I want to show you. All the points that we have discussed. This is an important image. That figure, that image. Uh, Internet is giving problem. I think that is it. Definitely there is some problem. This is an important thing. You must see this 210558. 210558. अभी दोनों आ गया. Strange. Now see, the most important point is which point? बड़ा करूं? 65. Can you see? सबको दिख रहा है? Nobody is able to see?
बहुत छोटा है सर, नंबर ऑफ दिख
This is UV
हाँ दिख रहा है, दिख रहा
65.
है, दिख रहा है सर.
And this is connected to all these points which I have said. 52, 51A, 50, 50C, 50B, 50A, 52, 51. So this point, if you take care of, all male and female genital problems are touched. Then comes UB64, which is taking care of 49A and 49B. Most importantly, BL50C for clitoris and for your penis, that is taken care of by touching BL63, which is also taking care of sacral innervations. Well, see, this is 50C, this is 63. So what you should do, you should select BL63 and BL65, and you can tonify these two if you are normal, if you don't have any problem in your prostate. If you have prostate, then this will have to be sedated and forget about the other things. So that is, otherwise, what you can do, you can put a seat. That is the best thing. एक मटर का दाना रखा, and then if you know BG meridian, then you can go where? 65 will lead you where? कहाँ ले जाएगा? 65 will lead you to gallbladder meridian, isn't it? Venkatesh,
Yes, sir. Yes, sir.
you know it.
Yes, sir.
This was an important image which I gave you. You can just take a screenshot.
Yes.
You can put the screenshot there if you want. You want to?
Yes, sir.
Take a screenshot and put it in the group. Urinary bladder 63, 64, 65, and their related points, all related points as shown above, should be measured if the ID occurs at 63, 64, and 65. So if there is pain at 63, 64, and 65, then all these points may be affected. Therefore, if you treat 63, 64, and 65, then all these points will be touched. That is common sense. Right. So this was very important, which I wanted to tell you. Okay. The rest of the points are, I don't think there's much in it. Of course, you know it, which point is innervating which point. There are two lines of urinary bladder on your back, on the right and left. The second one is generally connected to lymphatic network, the second line, which is four fingers, three pull from the middle of the spinal cord. The important point is UB30, I have already spoken about. Then comes UB12 is another important point, which is SMP of bone system of the whole body. So a deficiency on the side of traumatic incidents or indicates cells ruined or fracture or something like that. So then you should use UB12 on that particular side where there is a fracture or trauma. Even deformity, UB12 will affect and it will help. Scoliosis हो जाता है ना, उसमें UB12 हम लोग यूज करते हैं. UB11 is of course an influential point, an upper shoe point of SP4, P6, SP4 especially. And it is also SMP of vertebra, full spine. So पूरे स्पाइन की ट्रीटमेंट के लिए एक सिंगल पॉइंट कौन सा? UB11. So calcium metabolism as well as spine. So UB11. So UB11 is a very good point. UB10A is superior cervical ganglion. This is sympathetic ganglion. So this can increase pressure and blood flow. The blood will reach all over. It innervates thyroid also. Right? So this will supply. So in hypothyroidism also, UB10A should be used. Between UB10 and UB11, there is a lot of distance. So that if you equally divide into one third, one third, one third. So you will find A, B, C, or A1 and B and C. A, B, C. C is inferior ganglion and A is superior ganglion of cervical region. सर्वाइकल के लिए एक और पॉइंट है सर्वाइकल गैंग्लियन के लिए TW1A. Do you remember? And there was another one. What? TW16. You remember? Triple warm-up meridian?
Yes.
We had just discussed yesterday or maybe day before. 10B is Big point, nucleus of medulla. मेडुला में बहुत सी चीजें हैं, नहीं? कार्डियक सेंटर, रेस्पिरेटरी सेंटर, वॉमिटिंग सेंटर, कॉफिंग, स्नीजिंग, swallowing. मेडुला अकेला ही ब्रेन का बहुत बड़ा पार्ट है, ब्रेन स्टेम का. सिंगल पॉइंट इज UB10. So if you have any problem related to upper burner, heart or lungs or anything, and if you have coughing, sneezing, etc., or vomiting, don't forget, if you are not getting results from your regular meridian and treatment, you can use UB10. And remember, UB10 is that particular point where the nerves are crossing from right to left and left to right at the level of medulla. So if there is a problem in the brain, and if there is any kind of, for example, hemiplegia or anything, so then this should be used on the opposite side. UB9, the other day I had talked about pons, nucleus of pons. So I said the trigeminal nerve comes out of it, and the trigeminal neuralgia is very, very painful. In that you use UB9, you first put a needle and then you use the other points. UB2, point of frontal sinus. So this brings us to, there's another point. UB23 is backshoe point of kidney. Just in the same level, you find UB47. UB47 is lymph of kidney. You see, second line, all the points are lymph. So lymph of stomach, lymph of spleen, lymph of lungs, lymph of heart, all that second line. But of course, that is superficial. This was not in TCM. This was developed by, and it has been claimed that Prayagraj has found this particular aspect of the second line of UB meridian. So you may not find in the classical books, but in this book, Treatise 4, you will find it. This is all. We have come to an end. UB meridian. Of course, there are many more things which can be learned through the books which you have got. So we have come to an end, and we will end this class and this session. Next class, there are two options. Either we go for BG meridians, or we go for long meridians and teeth diagnosis. And then go to BG meridians. So whatever is your preference, I shall put it in the group. And let us see what some people prefer. And we will do it maybe after a week or so. So then good night. Shall we?
सर ये अभी जो नेक्स्ट कोर्स के बारे में आप इसी ग्रुप में बताएंगे या कोई दूसरा ग्रुप है आपका कॉमन?
दूसरा ग्रुप है कॉमन, है ना? हाँ, लर्नर्स ग्रुप.
लर्नर्स ग्रुप मेरा वो ऐड कर दीजिए सर.
आप नहीं है उधर?
नहीं,
मैं ऐड करूंगा. आई शैल ऐड.
थैंक्स सर. और थैंक्स सर, बहुत कुछ सीखने को मिला. फर्स्ट टाइम था तो आई थिंक लेवल 1 लेवल 2 करूंगा तो बहुत कुछ और क्लियर हो जाए इससे
हम्म।
बाद।
अभी
थैंक यू
तो
सर।
जो जो भी आ रहा है, whatever topic comes in, try to join if you can.
Yes, man, I am going to join all classes.
हाँ. Okay,
I will join
Venkatesh.
all classes.
हाँ. You must be practicing well. आपने तो काफी कुछ कर रखा है, रिपीट भी कर रखा कई बार. Those who are repeating, they will have 50% discount in the fees. You know it, Venkatesh, of course. No? आपको
Yes,
तो
sir. Yes.
मालूम है यार. Those who repeat, they get 50% discount. Okay then, good night. Hmm?
Good night, sir.
Yes.